Okay, so good afternoon, everyone, and thank you so much for joining us. So this presentation is really about learning how to facilitate a healthy return to school, looking at what is COVID-19, what is case management and contact tracing, infection prevention and control, and how can you go about doing your job as an educator and accessing support from us here at Public Health. To start off the presentation, sorry, I'm just going to introduce our presenters. Actually, we'll introduce ourselves.
Hi, good afternoon. I'm Lori Ross. I'm a registered nurse in the infectious disease program, and I've been with Niagara Region Public Health for over 30 years and 20 plus in the ID program. Since March, I've been involved in case and contact management throughout the community, working with childcare centers, workplaces, and outbreak management in regards to long-term care homes and acute care sites through Niagara, and just trying to keep up with the countless documents and versions of documents that I'm sure that all of you are trying to keep up on as well.
Good afternoon, everyone. My name is Brandon Krupa. I'm a public health inspector team leader in the environmental health division with Niagara Region. I've been involved in the COVID outbreak management team since the beginning of the pandemic. I've been involved heavily with the reopening of the businesses through the different stages laid out by the province, and on a number of different working groups regarding the safe environments and dealing with the pandemic.
Thanks for joining us, everyone. My name is Brian Yo. I'm a registered nurse in the infectious disease program here at Public Health, and recently took on the acting infection prevention control supervisor position. I've been quite involved with COVID since March, and I've been working on things such as case and contact management, and more recently working on COVID outbreaks in some of our institutions like long-term care homes, retirement homes, hospitals, workplaces, and whatnot. I've also had the opportunity to sit in on some of the teleconferences with the school boards and some of the schools and whatnot as we've kind of planned for the reopening.
And my name is Austin White, and I'm one of the public health nurses on the school health team. So typically I am the school nurse for the elementary schools in Grimsby and West St. Catharines. But since March, transitioned over to our COVID info line, and more recently now in working in infectious disease on case management and contact tracing. So we'll start off with a video from our Associate Medical Officer of Health, Dr. Andrea Feller.
I'm Andrea Feller. I'm a pediatrician and public health physician here in Niagara. And, with that, our staff, myself, we've really been privileged actually in the last 5 months. We've been immersed in this work. We've been able to see how the virus works at the individual level, the group level, and the broad population level. And I think that, stepping back and thinking of the conversations I've had with so many parents and families and teachers that I know, it's important that we really remember how different it is when you're not immersed in it every day. And you're being asked to come back to work now, you're being asked to prepare in a very short amount of time for all your children that you care about so much and look after for their well-being, for their growth, their development, their learning in social, emotional, and all the areas, not just reading, writing, and arithmetic. Reading, writing, arithmetic as in the old days. So I really recognize that, and all of us recognize that and want to help and support you as much as possible. The other advantage a lot of us have is, for example, myself as a pediatrician, I have a really good comfort level in terms of coronaviruses with children. And this current one, as all the others, this current one, COVID, it can be dangerous for some children, absolutely. But in general, it's not so for the vast majority of children. And we saw this with SARS, and it was the exact same thing. And now we continue to see evidence that in addition to not being harmful for most children whatsoever, that children really are not likely to spread the disease nearly as well as we know adults do. So we have that reality. And then on the other hand, we know that school is critically important. Caring for children, whether they're in your family, they're at home, or they're in school, it's still caring for children and their well-being, whatever age they are. So the interpersonal skills, the teamwork, the emotional regulation, the social skills are just as important for their development as all of the cognitive education and learning that you do, and you know this better than I do. So putting those two together, then you're faced with a big dilemma, right? What do you do? So as the fall comes towards us, we do think that the choice was the right one to reopen schools. And what we want to do then is help guide all of you here locally within the guidance that the government has given, and leaning towards being precautionary, for sure, not taking unnecessary risks. What we're doing is working with all the schools, all the boards in Niagara, to help all the leadership and staff know, out of all those areas that need to be implemented, what are the ones that if you have extra energy and time that you really want to invest the most effort in, because you need to know that from us. In the 5 months in Niagara, how can we make sure that you know, out of everything that we see that works and doesn't work, that you're investing in the most important areas, in addition to ensuring you've got all the basics down that the ministry is requiring. So with that reality and being able to focus in a very short amount of time, we are working with all of those groups I mentioned to share with them examples of the top 3, top 5 items to really focus on. And you might not be surprised to hear that they're largely focused on adults. And that is just a given at this point. We know that, sort of the top 3 things you could be doing really is really good screening of all the adults that are coming into the school setting. And we can't emphasize that enough in terms of our comfort with the knowledge that if you catch people at the earliest sign of a symptom, whether it's a headache, a mild sore throat, feeling more unwell than you expect just from all the anxiety and stress, those should not be disregarded. And those should be criteria to say, don't come in. And the leadership is there, the leadership at all the schools, to say, you have the permission, we don't want you here, because it's one of those weird times where adults are more germy than children are. The other thing about it is we're all essential workers, right? And so I think about it almost the same as child development. The brain is wiring. Well, our brains have been rewired in a way so that when we have a mild sore throat or a runny nose or a bit of a headache, it's not that we ignore it, it's that we often aren't even consciously really aware of it, because our brain has adjusted to the fact that we work through all of those things, or we parent through all of those things. So that screening is a very critical opportunity to say, whoa, you might not have thought anything of it, you might not even have realized it, let's check. Do you have any of these things? And so that's the top number 1, 2, and 3. Physical distancing is the other thing I want to mention. You'll hear a lot more in the sessions, but physical distancing, especially for adults, and I can't emphasize that enough. So our emergency child cares are a great example. They did a phenomenal job that they did that screening every single day, one-on-one, and then also the adults stayed away from each other and 2 meters from the children. So you'll hear a bit more about that as well, because it raises a lot of questions. But all of the children that I saw over the summer, all the experience we had in the child cares, the children get used to it. And they say, okay, we stay away from Miss Marie, or we stay away from Mr. Brandt. And they understand that staying away is super important. It's important for children to have that distancing and the masks and the other things too, but it's much lower in terms of the impact it's going to have on preventing infections. So with that, really want to share with you that these things are happening. I wish I could be there individually to answer every single one of your questions, but knowing that school is so critically important for our children, and that for the vast majority of children this fall, it is the best place for them to be. We want to make sure that if your questions are not answered, that you have an opportunity to let us know what they are, that we can answer them, and that you have a comfort level, that you get to a comfort level both with, the things you have to focus on, because let's be honest, we've gotten to a place where everybody wears a mask now. Most people wear a mask over their nose and mouth. It took several months for that. But let's be honest, how many of you have that mask shoved in your pocket, in your glove compartment? hanging up, my cameraman is looking away, hanging off your rear view mirror. We have a long way to go. We don't turn into a mask wearing society overnight. We're in that second stage now where our focus has to be on adults taking that mask off properly and storing it properly. It's either on your face properly or stored properly. So you can imagine with all of those things, the ability that we have to give you guidance on where to focus the most is going to be very helpful for you, because then you can reassure the parents and say, you know what, there will be cases. We know there will be cases. There's no risk option, but on balance, this is absolutely the best option moving forward, and we are doing it with the best available information and evidence to try and absolutely minimize any spread of COVID within the schools. And if it does happen, to be able to respond immediately and again, minimize any harms from that. So thank you again. You know, there's nothing that can make this simple or easy or take away all of the anxiety. So I will say as well, look after yourselves, take care of yourselves, and thank you so much for what each and every one of you do for the families and children in Niagara.
Okay, moving on to the objectives. Participants will develop a basic understanding of the COVID virus and how aspects of the virus are associated with case, contact, and outbreak management. Infection prevention and control measures are understood and can be implemented as an important means to reduce the transmission of COVID-19 within the school environment. Participants will have a high-level understanding of COVID-19 case, contact, and outbreak management and the associated roles of Niagara Region Public Health, school boards, and administrators. Within their roles, participants are prepared to safely support students in their comprehensive needs. Educators, administrators, and staff feel supported and know where to access credible and comprehensive resources to facilitate a safe and healthy return to school.
So looking at our agenda for today, beginning, we're going to go over the basics of COVID. What are the what's the transmission, the incubation, symptoms that may present. Moving into infection prevention and control, how do we prevent the spread of COVID-19, and looking into cleaning and disinfecting of the school environment. Then looking into case management and contact tracing. What does that mean and what does it entail? Then moving into personal health information, the importance of maintaining it. Then outbreak management, what is the definition, what does it look like, and what are the rules associated? And then moving into support. So how do you as educators and school staff go about supporting your students, and how do you access support for yourselves? So accessing the school health nurse and public health staff. So we will be saving questions for the end, but if you do have questions during the presentation, please feel free to enter them into the chat. And we will answer them at the end. We will also be taking the opportunity to unmute mics. So if you have a question that you'd like to ask over the mic, you can. And then following the presentation, we will be sending out these slides with an additional Q&A.
Thanks, Austin. So here in Niagara, we had our first case of COVID. I believe it was the second week of March. And one of my biggest takeaways as kind of we've worked through this pandemic over the last 6 months or so is that you know, this is a new virus, and because of that, information is going to change over time, and therefore guidelines are going to change over time as well. And you know, it's certainly been frustrating when things change, but I think you know, again, because it's a new virus we're dealing with, it's just kind of the way it is. And because of that, it's important for all of us to just remain flexible and open-minded as we work through this together. The intention, or we wanted to start the presentation by just reviewing some of the important aspects of the virus that we hope will give you some degree of background or, you know, foundational knowledge that will better bring into context some of the aspects of case and contact management, and kind of help you understand some of the rationale for the infection prevention control measures and PPE recommendations and whatnot. So even though the COVID-19 virus is a new virus, and it is a virus, so because of that, most viruses we don't have very good treatments for. So for the most part, when somebody's ill with COVID-19, we more or less just have to let the illness run its course. So even though this virus is new, it's from a family of viruses that we've known about for some time, and you've probably heard of SARS before. So SARS is a different virus, but it's from the same general family of viruses. And we actually have a seasonal coronavirus as well that again is from the same family, but is quite common and known to circulate during our cold and flu season, and is one of the viruses that can cause the common cold. So as we know, Wuhan, China became quite famous in December as the starting point for the COVID-19 virus, and where it was first detected in humans. And since that time, the pandemic has become worldwide, as we know. So one of the first aspects of the virus that I wanted to talk about is transmission. So how does the virus spread from one person to another? And so one of the main way that it's spread is through respiratory droplets. So essentially what you need first is somebody that's actually infected with it. And what you need next is for a means for that virus to actually exit the person's body. So in this case, the virus would exit the person's body through their nose, through their mouth, and that would be done during sneezing, coughing, singing, yelling, and whatnot. Now, we don't consider this virus to be spread airborne, but there is some degree of movement of the virus through the air. So the virus survives in respiratory droplets. And it can travel up to 2 meters through the air. Okay, so we have that kind of that movement of the virus through the air. So next we need a way for it to actually get into the body of another person. And the way it gets in is through eyes, nose, and mouth. Okay, so we want you just to kind of keep in mind the ways that it gets into the body, because then it's going to make more sense to you when we start talking about personal protection equipment. Another thing I wanted to talk about is the fact that infected persons do not have to have symptoms in order to be contagious to others. So that's an observation that we've made. And we're just going back to transmission again. I also forgot to mention that the virus can survive on surfaces, and this isn't the primary way it's spread, but it is a possibility. And so how this would work is, again, you need an infected person. Let's say they cough into their hand, and then they touch an object such as a doorknob. So now the virus is spread from the person to the doorknob, and then another person comes along, touches that same doorknob, they get the virus on their hands, and if at some point they bring their hands up to their face, the virus can make its way into the body that way as well. Before I go on, there was actually some more information I wanted to give you, just kind of some introductory information before we talk about the virus itself in too much more detail. And so I just wanted to give everyone just kind of an update on the current COVID situation in Niagara currently. So to date, we've had 940 cases. And of those cases, 62 of them were under the age of 20 years old. So it's that's about 6 to 7%, which is on par with what we see provincially. So I believe in the province of Ontario, it's about 5% of cases are children. So it's certainly a majority of our cases are adults. Now, of course, you would need to take that data with a grain of salt, because for the most part, things like schools and playgrounds and whatnot, and any other place that children might go have been shut down. So, there's been less risk of exposure for children over the last 6 months. For the most part, the virus does cause a mild to moderate illness, but as we know, in some cases, it can cause more significant illness. In Niagara, we've had about 64 deaths attributed to COVID. About 10% of our cases require hospitalization, and about 3% require more intensive care treatment. And currently we have 11 active cases in the region. So we've certainly seen a downward trend since where we were at in April. But you know, when we start opening up things like you know, businesses and schools, obviously there's going to be more chance for transmission in the community. But I think it's you know, it's reassuring when you see lower case counts in the community, because it's going to be associated with lower risk in the schools. So I'm just going to continue on now and just continue to kind of give you some information about some key aspects of the virus. So another important aspect of it is what we call the incubation period. So essentially what the incubation period is the amount of time from exposure, so from the time that the virus actually gets into your body to the time that you have the onset of symptoms. And one of the challenges with COVID-19 is that it has a pretty lengthy incubation period. So it's up to 14 days. So 14 is a number that you're going to see come up again. And so I kind of want you to keep this concept of incubation period just in your back pocket, because it's gonna come up again and have more meaning when we talk about case and contact management and outbreak management and whatnot. So 14 is, you know, the upper limit of our incubation period, but most commonly, it takes about 5 to 7 days after you get the virus in your body for you to actually start developing symptoms. So the next important aspect of the virus is the period of infectivity. And so this is the duration of time that an infected person is contagious to others. So one of the challenges with COVID, and this holds true for a variety of other infectious diseases as well, is that people can actually be contagious to other people prior to even showing symptoms. So that's definitely a challenge. In the case of COVID, a person is potentially contagious 2 days prior to their symptom onset, and they remain contagious up to 14 days after their symptom onset. So when it comes to the symptoms of COVID, I have them listed here. As you can see, there's quite a wide range of symptoms, and this does lead to an additional challenge. So some of the symptoms are more unique to COVID. So for example, the loss of smell, loss of taste, that's, you know, fairly unique to COVID. But some of these other symptoms are very general, they're very common. So things like fever, cough, runny nose, sore throat. There's a lot of different things that can cause those symptoms. There's also the potential that somebody could be infected and have no symptoms at all. And then of course we have just varying severities of symptoms. So some people have very mild symptoms, and as we kind of discussed, some people do have more severe symptoms, and in some cases they have respiratory distress, pneumonia, and in some cases it can cause death. So quite a varying range of symptoms. And because of that, one of the take homes I want you to get from this slide is using a low threshold when you're screening yourself before going to work. And when I say using a low threshold, I'm talking about, you know, being mindful of those really mild symptoms, or being mindful of unusual symptoms, or symptoms unusual for you, and trying to make a conscious effort to pay attention to that, because sometimes, you know, the symptoms can be easily missed. I'm going to touch on testing a little bit as well. This is going to come up again when we start talking about our case and contact management. So just to start off, I want you to be aware of where you can actually access testing. So we're fortunate enough that Niagara Health has established COVID assessment centers here in Niagara. And so if you are in a position where you would like a test, you can do that a number of ways. So you can actually call Niagara Health directly and schedule an appointment, or you can just walk in. I think scheduling an appointment is probably preferable. Walk-in, sometimes there can be a little bit of a wait. The other way that you can facilitate testing is actually calling the Niagara Region Public Health COVID information line, and our staff on the COVID line can actually refer you to the testing centers. Okay. So in terms of who we actually recommend testing for, we recommend it for symptomatic persons, so people that are having or experiencing symptoms that could be associated with a COVID infection. And we also recommend it for people that were identified as close, like high risk type contacts of confirmed cases. So if you find yourself in a position where you are being tested for COVID, one thing that we're going to ask of you is that you isolate yourself at home while your test results are pending. And we do also ask that any of your household members also self-isolate while you are waiting for your test results. Okay. The testing does have limitations, which I'll get into a little bit. It brings me to my next point. That's that a negative test does not necessarily rule out infection. So, people can be tested for a variety of different reasons in a variety of different contexts, and sometimes there's some degree of interpretation that needs to be made. But if you're a symptomatic person, like you're ill and you go and get tested and it comes back negative, I'd be pretty confident that that test result is in fact a true negative. But sometimes, like let's say you're in a situation where you were identified as a close contact of a case and that was your reason for getting tested. So you're at this point, you're not symptomatic, you were just identified as a contact, you wait your 5 to 7 days and you get tested. The test could come back negative, but it does not necessarily rule out the possibility of infection. And so what we're seeing is that sometimes if you're tested too early on in your infectivity period, or in your infection, I should say, you might not have a viral or enough virus in your body at that point to actually trigger a positive test. So there are circumstances where a negative test doesn't rule out the infection, and because of that, if you're ever identified as a contact, a negative test doesn't actually impact the amount of time that you need to isolate for, which I'll bring up again when I speak about contact management. Another aspect of the testing that's important to be aware of is that a person with a known COVID infection can actually continually test positive for many weeks after their infection. And the reason for that is the way the test works is that it detects genetic material of the virus, but one of the limitations is that the testing can't differentiate the difference between live virus and dead virus. So you could have had an infection, you're at your 14 days, you decide to go and get another test and it's still positive, right? So at the 14-day mark, we are still confident that you're no longer contagious. And the reason for that positive test could be just sort of that genetic material that's still left in your body from the dead virus. So because of that, we don't normally recommend repeat testing, as a means to say prove that you've cleared the virus as a criteria for returning to work or school.
Thanks, Brian. So I'm going to take over for the next few slides in regards to infection prevention and control measures that we can implement in our schools, childcare settings to prevent the potential for COVID-19 transmission. I just want to note that prevention is key. It's a lot easier to prevent an infection than it is to control an infection sometimes. And you did note that Dr. Feller stressed the importance of screening. And, she has used the terms critical, that it's critical that we're all screening, that it's our first line of defense before we head out the door, not only for school, but if we're attending even family gatherings, we should all be very cognizant of the way we're feeling. And she did say it's the top 3 things that we can be doing every day. And not only as educators, but also in everyday life that we move through. We know that school boards are advising both staff and parents on screening at this time and providing them links to potentially self-assessment tools, or you may be using apps that your school boards have developed. So whatever way it looks in your school or your school board, I can't stress enough about the personal responsibility that we all have in screening ourselves on a daily basis. So going to those self-assessment tools on the Ministry of Health and moving through the whole tool, the complete tool, not kind of stopping at the beginning, which you can tend to think that that's maybe where you need to stop, but keep moving through that assessment tool. Parental agreements, I believe, have been sent out by some schools and some boards, and that's the request that parents and guardians take that responsibility of daily screening. And again, stressing the importance of daily screening to your parents in messaging, and I know that the schools have already done that and will continue to do that. That's something that has to happen every single day before they hit the door of the school or you hit the door of the school. Brian noted the low threshold for symptoms, and again, I'm just going to stress that you know, at the beginning of this pandemic, you know, the top three, you know, symptoms that we were looking for were, you know, cough, shortness of breath, difficulty breathing. You know, those symptoms have expanded, and obviously children's symptoms differ from adult symptoms. So we need to be looking at those and using that low threshold. You know, even that loss of smell, the loss of taste as being, you know, abnormal, and seeking medical attention through your healthcare provider, or requesting information on those symptoms and, you know, what you need to do. Any of those symptoms, and Brian's going to go over this, we should not be presenting at the school door, or the children should not be presenting at the school door. Friendly reminders such as signs, I'm sure that schools will have them posted if they don't already. Those are available at Public Health, just to remind parents as well as staff and essential visitors about the importance of screening. If a student or staff member fails a screen at the door, so they've left home and now something's come up and they've realized that they've developed a symptom, or maybe they've ignored it, they should not be entering into the school, and again, seeking advice through their healthcare provider. Students, staff, and other employees of the board who are identified as close contacts of the case within the last 14 days will fail the screen and need to be excluded, and that information will be provided by Public Health. The one thing that I wanted to note about screening symptoms, again, we talk about it at the beginning of the day, but it's something that we need to think about throughout the day. You know, children or staff may feel well when they leave their home in the morning, and it's over the day where they may develop symptoms. And, you know, certainly we're not asking educators to diagnose a student or a fellow colleague, but just noting the symptoms and you know, separating that child, or providing that, you know, that reminder to staff that you know, they may have presented or they may have developed symptoms that they're not even really recognizing. So separating the student in the guidance documents from the ministry, it does speak to an isolation or designated area. We need to ensure that the administrators are aware of that child who's developed symptoms. Again, separating them, bringing them down to that room. We're going to talk more about PPE and what it looks like when that child or that staff member is in that designated room. Obviously calling the parents, and through that parental agreement that they've completed, they will have been asked about numbers and designated folks that can pick up that child immediately. And also, if you're the staff member, again, it's immediately leaving the school and speaking to your healthcare provider. So again, self-screen, not only for for schools, but also for everything that we do on a daily basis, and not leaving the home with those symptoms. Physical distancing, the objective obviously is to reduce the likelihood of that droplet that Brian talked about being transmitted, you know, within a close radius to somebody, or even onto, you know, onto objects. So the current distancing recommendation in Canada and the US is currently 2 meters or 6 feet. There is indication in some literature, you'll notice 1 meter, but we do follow Public Health Ontario and Public Health Agency of Canada guidelines, as well as your ministry guidelines, that speaking to the 2 meter distance between desks and you know, other activities that might be happening in the classroom, whether it's activity stations, and Brandon will speak to activity stations. So we need to combine it with a few things, right? We just can't have physical distancing happening. We need to obviously combine it with proper hand hygiene. We need to combine it with respiratory etiquette so that we do limit that transmission. Physical distancing, you know, is going to be a challenge, right? So we just need, like Brian says, we all need to be flexible and understand that Children are coming back into a new environment. Staff are coming into a new environment with arrows and markings on the floor. And we're all going to need those friendly reminders, whether it's a staff person or a child, on how we're physically distancing. So what does it look like, or what can it look like in your school? And I'm sure that every school is taking a different approach to markings on the floor, whether they be arrows for, one-way flow in the classroom, down the hallway to the washrooms, outdoor activity. However they're marked, and hopefully they're easy to follow for those students. Plexiglass or barriers may have been installed in some areas of the school, so that's another way of social or physical distancing. Desk placement, again, that 2-meter radius or 2-meter distance between desks, and that desk should always be hopefully forward facing or facing in the same direction. We should avoid the desks in group or circle type, around the desk, that everybody is facing in the same direction. Signage, again, I think I mentioned this already, the more age appropriate and friendly signage probably is going to work better. And I'm sure you're talking already for the last couple of days are how are washroom breaks, hand hygiene breaks, and lunches and outdoor activity going to be staggered, but that's the ultimate goal is to keep them apart. I think the biggest challenge probably, besides being in the classroom, is going to be outside. So when they're outside, that's most likely when they're going to have that mask break that they're all going to be looking for, and it's trying to keep them distanced at outside activity as well. And the last point is, if we can't physical distance, obviously we need to ensure that we're wearing our masks and we're wearing them properly. And Brandon's going to go over that information. Hand hygiene, it's the most important infection prevention and control measure we can do, even pre-COVID, right? So that we should be practicing that. So, ensuring whether you're the educator in the classroom, you're the custodial staff in the school, that your units, your bathrooms in your classrooms are equipped with liquid soap, paper towels, and the paper towels are in a dispenser. So hopefully not laying down on a counter or in a roll on the counter where they're going to get wet and potentially contaminated. Hand hygiene products that are throughout the school in the classroom, washrooms, obviously need to be accessible, and we want them to, if it's alcohol-based hand rub, to have an NPN number, and Brandon will speak to that. There's other products that have NPN numbers, but we want to see that so that we know that it's an effective hand rub that's being used, and that it's within its expiration date. The alcohol-based hand rub that is typically recommended, the percentage of alcohol should be 70, but it can be anywhere from 60 to 90. And so why do we recommend 70? Not only for COVID virus, but also for other viruses that unfortunately we really don't want to think about, that are, we're moving into that season of, besides COVID, influenza. So there are other respiratory illness that's going to start circulating, and also the virus called norovirus. Some people call it the winter stomach flu. So that's the vomiting and diarrhea, and that percentage of alcohol-based hand rub at 70% will effectively, take care of that. Obviously the one thing that we're going to discourage, because we know about droplets, is, the minimum time that we want children or adults to be washing their hands is 15 seconds. We used to encourage, the singing of the alphabet, or, happy birthday, but singing should obviously be discouraged at this time. And the last thing I wanted to note just about alcohol-based hand rub, if you are keeping it in check in your classroom, is that we should not be topping up alcohol-based hand rub dispensers. They're depleted and they're replaced. And the reason why is we don't want any type of contamination being built up in that alcohol-based hand rub. And last point, but most importantly, is that soap and water should be used on visibly soiled hands. Alcohol-based hand rub is used on non-soiled hands. Key moments for hand hygiene, common sense things like, obviously now we're entering the school, we're cleaning our hands, exiting the school. Brandon's going to speak to this, but before putting on a mask, before bringing your hands up to your face, again, remember what Brian said is that, our mouth, our nose, and our eyes are that portal of entry for this virus. After taking off a mask, because the outside of the mask is contaminated, and if we've touched it, we want to ensure that we're cleaning our hands. Lunchtime, washroom breaks, anytime we're outside, outdoor activity, any shared equipment between students, between cohorts, and obviously, if you have a student in your care or in your classroom, is that if you need to assist them with mask use, hand hygiene, or respiratory etiquette, that you're doing it, first of all, correctly by, how you're applying the mask and touching the mask is the importance of hand hygiene for yourself. And the last slide that I'm going to take care of in regards to prevention is around respiratory etiquette. So I did cover a little bit about this, but again, stressing the importance with your students at this time, age appropriate, that they need to be covering their mouth and nose with a bent elbow or a tissue, especially if they're in one of the grades where masks are not being recommended, they're being encouraged. Brian did mention about the pre-symptomatic phase of illness. So, always stressing good respiratory etiquette and encouraging that disposal of tissue. So what do you need in your classroom? If you don't already have it, take a look around. Obviously you need tissues for the students or for staff. Aligned or no touch wastebasket. So if you have one that has a foot pedal, great. Hand sensor that's operated that way, or an open basket that the children have the ability to toss their tissue in. Alcohol-based hand rub again, and your sink should have soap water, running water, and warm water and paper towels that are in a dispenser.
Okay, moving on. Masks and personal protective equipment are essential in preventing the spread of COVID-19. Masks are typically utilized for two reasons, either as personal protective equipment or source control. So personal protective equipment is equipment and clothing worn to minimize exposure hazards to prevent illness and infection to the wearer. Other examples include eye protection, gowns, and gloves. Masks worn for the purpose of source control are meant to prevent the spread of the virus or bacteria from the wearer to others. So masks, when they're worn as source control, obviously provides more protection than not wearing a mask at all. Masks reduce the transfer of fluids from the wearer to others or vice versa, and act as a barrier to touching your mouth or nose with potentially contaminated hands. However, just note, masking can lead to additional contact with the face due to discomfort in adjusting the mask. So as Lori just stated, the need for meticulous hand hygiene is essential. So looking at the steps to put on your mask, again, that hand hygiene step, followed by securing the elastic loops of the mask around your ears. If the mask has strings, tie them securely behind your head. Cover your mouth and nose with the mask and ensure there are no gaps between your face and the mask. Do not touch the front of your mask while you wear it. Wash your hands or use alcohol-based hand rub if you accidentally do come in contact with the front of your mask. So removing your mask, again, do not touch the front of it. This is the area with the most contaminants. Remove the elastic loops of the mask from around your ears or untie the strings from behind your head. If the mask is soiled, damp, or damaged, hold the loops or strings and place the mask in a garbage bin with a lid. If the mask can be reused, hold the loops or strings and place the mask in an appropriate storage container. Always note, when you're folding the mask, have it folded so the outside is folded in and touching to reduce the risk of transmission to the wearer. And again, wash your hands with either soap and water if visibly soiled, or alcohol-based hand rub. So another common question we get in public health is face shields. So face shields are devices that have a transparent window or visor supported in the front of the face and provide a barrier of protection to the facial area. They're considered personal protecting equipment and an alternate to goggles. They're not meant to function as a primary device for respiratory protection. People often think that they can wear a face shield and that excludes them from wearing a mask, but is not the case. If the face shield appears damaged or compromised, very important, do not use it. If the foam piece on the inside that comes in contact with the forehead, with your forehead, is visibly soiled, do not reuse. And the same person should be reusing a single face shield if it does have that foam piece. That is because that foam is an absorbent material and cannot be properly cleaned and disinfected. So looking at the steps to clean a face shield, first and foremost, wash your hands and put on gloves. If visibly soiled, clean the face shield with soap and water. Always clean from the inside out. Rinse with water and remove any excess water that may be on the face shield. Use a disinfectant wipe and thoroughly wipe the interior of the face shield, followed by the foam band, the exterior strap, and the exterior of the shield. Always follow the manufacturer's instructions on how to properly clean and disinfect these face shields. Allow to air dry, remove your gloves, and store in a clean designated area. Now note, if the face shield is not visibly soiled, the cleaning with soap and water can be skipped, and disinfecting wipe can be utilized immediately. So looking at more information regarding personal protection equipment, school staff who are in regular close contact with students will be provided the appropriate personal protective equipment through the government of Ontario. PPE should be worn during interactions with a suspect case of COVID-19. If the student is ill and in the isolation room, or there is risk of coming with bodily fluids. PPE selection is based on the type of interaction with a student or staff member. Brian will get into a little more details on this, but like I mentioned, other PPE includes masks, gloves, gowns, and eye protection. It is also important to note that any PPE requirements supersede source control policies. So I have a couple diagrams here outlining the steps for putting on and taking off your PPE. These are available on our website and will be something we'll highlight at the end of the presentation. So when putting on your PPE, or known as donning, the first step again is perform hand hygiene, followed by putting on the gown and then the mask. The fourth step is to put on any eye protection, and lastly, put on the gloves. Now, taking off the PPE, this is very important because when you're removing PPE, you're likely in close contact with a case or a suspect case of COVID-19. So your PPE is considered soiled, and extra caution should be taken when removing. The first step is to remove the gloves, followed by the gown. At this point, a hand hygiene step is required, followed by removal of the eye protection and the mask. And last but not least, performing hand hygiene once again. When discarding the PPE, it should be discarded in a proper bin, like Lori mentioned, at the point of care or where you were in contact with the potential case. Another question we get quite often here at Public Health is regarding air circulation. Schools should implement practices to support adequate air circulation in classrooms and staff rooms. This is done by ensuring the filters are clean, avoid recirculating air, use outdoor ventilation when possible, so opening windows or increasing the amount of outdoor air in the HVAC systems. We often get questions about portable air conditioners or fans. They are acceptable. However, they should be limited during the day, used on the lowest setting, and positioned to direct airflow upwards, away from any surfaces or people. Regular maintenance of these units is required, including routine cleaning and disinfecting of all surfaces, including the fan blades themselves. Always follow the manufacturer's instructions of these units for how to properly maintain and clean them. And lastly, remove any moisture or water collected by the portable air conditioning units. So moving on to environmental cleaning. Cleaning and disinfecting are two terms that kind of get used interchangeably when in fact they are different. Cleaning removes germs, dirt, or debris from surfaces and objects. Cleaning works by using soap and water to physically remove any organic matter. Cleaning does not necessarily kill germs, but by removing them, it lowers their numbers and reduces the risk of spreading infection. Disinfecting kills germs or viruses on surfaces or objects. Disinfecting works by using a chemical to kill the germs. Now, it is important that the surfaces or the objects that are being disinfected are free from any organic matter. This will allow the disinfectant chemical to work properly and we really get that direct contact with the surface or object that is being disinfected. Now, if the surface is not dirty or visibly soiled, the cleaning step can be skipped, and a wipe can be utilized that has both cleaning and disinfecting properties. There's more information on the link above that will direct you to the website, where we have a lot of information on the different products and how to properly maintain the environment, which we'll look at after the presentation. So during this pandemic, the cleaning and disinfecting process, schedules, and logs should be developed to ensure an enhanced cleaning and disinfecting program is implemented in the schools. This includes reviewing existing practices to identify required cleaning enhancements. So you're looking at the different locations in the school, the frequency, the timing, what PPE needs to be worn, and staffing, who is responsible for the cleaning, and the signage. We need to also identify inventory needs. Where can staff access additional cleaning supplies if necessary? And if the school is out, how will you go about getting additional products quickly? A cleaning log must also be posted and used to track cleaning and disinfecting. This includes having a staff sign off and date when different areas of the school were cleaned and disinfected. Now, it's important to only use cleaners and disinfectants that have a drug identification number, a DIN, or an NPN number. This means that the products are approved by Health Canada and have been tested, and that they will do and have the kill claims that the labels state. There's a very good list on that link included on this slide to the Health Canada website. And in fact, because there's so many of these products out there, you can search by name and determine if the product you are using is capable of killing COVID-19. And again, always follow the manufacturer's instructions for use when using these products. There's a lot of information in really fine print on the containers of these products. So it's important that you take time to kind of decipher and go through the steps and what's required and how to use the products safely and properly. So looking at some of the literature to date, and of course, COVID-19 is relatively new, so this may change. So this is what we know to date, is that the virus has a lifespan of about 3 hours on paper or tissue paper. This is a question we often get, is how long it can live on these surfaces. And as you go down the list, you can see that the different properties of the surface can allow for the virus to live for longer periods. So plastic and stainless steel, you're looking at 2 to 3 days. And on the outside of a surgical mask, you're looking at a week. So that's why Lori stated earlier, if you touch your mask, the hand hygiene is so critical to ensuring the transmission is not taking place. So lastly, where and when to clean. Any shared rooms or spaces must be cleaned and disinfected before and after using it. So this could be your library, gym, or any other shared spaces in the school where cohorts may be. Cleaning and disinfecting of common areas and high-touch surfaces should be done at least twice daily or more if needed. This includes your doorknobs, handrails, light switches, sinks and toilet handles, keyboards, and touch screens. Obviously, depending on the school, there may be more that need to be added. Shared equipment, supplies, and objects must be cleaned and disinfected between each cohort use. So this is your physical education equipment, art supplies, toys, and games. And then just due to the nature of sensory and water tables and the difficulty to clean them, they're not permitted during this time. So going on, we're going to review a short video here that kind of highlights other environmental factors that can be utilized in the school environment to keep the school safe.
Hi, my name's Ken. I'm a public health inspector with Niagara Region Public Health. Thank you for joining us today. Today we're going to be reviewing some principles for reopening your school. To start, I want to take a minute to talk about cohorting. The purpose of cohorting is to keep students together in small groups throughout the day to limit their exposure to multiple staff members and classmates. School administrators should also maintain records regarding which students and staff are assigned to each cohort. This will also help in facilitating contact tracing if necessary. Students should remain in contact with only their cohorts as much as possible. However, some students may be members of several cohorts, such as a class cohort, a bus cohort, and a before and after school program cohort. But remember, physical distancing should still be practiced within these cohorts. Students in grades 4 to 12 will be required to wear a non-medical or cloth mask inside of the school, including hallways and during classes. Students in kindergarten to grade 3 will be encouraged but are not required to wear a mask. When cohorts are outside for recesses, this can be an opportunity to provide students with a break from wearing their mask. When taking off the mask, though, it should be removed by using the ear loops and should be properly stored in a safe and sanitary location to avoid contaminating of surfaces and the inside of the mask. Hand hygiene should be practiced both before and after removing the mask, and any surfaces that may have been contaminated during this process should be cleaned and disinfected. Next, we are going to talk about everyone's favorite time, lunchtime. When possible, students should eat at their own desk in their classroom to ensure physical distancing. In schools with a cafeteria or lunchroom, lunchtime should be staggered to limit interaction between cohorts. Schools with cafeterias should remove all self-serve food items to reduce common touch points and replace them with grab-and-go style products. Water should not be consumed directly from the water fountains. Instead, students should fill their own reusable water bottles at the hydration station. And remember to practice proper hand hygiene prior to eating or drinking. When cleaning and disinfecting your classroom and common areas in your school, it's important to ensure you're following the recommended cleaning protocols provided by the Government of Ontario and the Guide to Reopening Schools document. Be sure to use an approved disinfectant that has a valid expiry date and a drug identification number, which would mean that it's approved by Health Canada. All products should be used according to the manufacturer's instructions, including the necessary contact time and dilution procedures if necessary. School boards should develop a program for cleaning and disinfecting, including the frequency and timing of cleaning, appropriate PPE for cleaning staff, and an inventory of products. It is recommended that each school keep a cleaning and disinfection log. To reduce common touch points, shared objects should be limited when possible, or the object should be cleaned and disinfected between uses. High-touch surfaces should be disinfected at a minimum of twice daily. However, more frequent cleaning and disinfection may be necessary. High-touch surface areas include doorknobs, light switches, keyboards, desks, and washrooms. In the event that a student or staff member were to develop COVID-19 symptoms, it is recommended that all schools have an isolation room. This room should be cleaned and disinfected after each use. Hand hygiene is an important step to preventing the spread of COVID-19. It is important that we determine when it is appropriate to use an alcohol-based hand sanitizer versus when you should wash your hands. If your hands are visibly soiled, it's recommended that you wash your hands with soap and water for at least 20 seconds. The sink should be properly supplied with hand soap and paper towels. Alcohol-based hand sanitizer should be located throughout your school with bottles placed at entrances and exits of the building and classrooms. We recommend that alcohol-based hand sanitizers be a minimum of 70% alcohol with a valid expiry date and an NPN. The NPN means that the product is approved by Health Canada. Whether using an alcohol-based hand sanitizer or soap and water, proper hand hygiene steps should be followed. Step-by-step hand hygiene posters for hand washing and alcohol-based hand sanitizers are available at niagararegion.ca/COVID-19 under the Reopening Schools During COVID-19 tab. Commonly forgotten areas when cleaning your hands may include in between your fingers, backs of the hands, fingernails, and your wrists.
So we reviewed quite a bit of information as it relates to infection prevention and control, and I'm sure for a lot of you, a lot of that information is new. Although hopefully not hand hygiene, that should not be a new concept for anyone. Yeah, there's a lot of information there, and we understand that might be a little bit overwhelming, especially when it's in addition to all the other aspects of your day, including actual teaching and whatnot. We want you to just kind of have realistic expectations. So even though, you know, our goal or aim is to get near perfect when it comes to our infection prevention and control measures, we understand that, you know, when you actually go to put these into practice, that there's going to be challenges. Every school is going to have unique challenges. And when we're dealing with children, again, our expectations have to be realistic, especially when it comes to their mask use and social distancing and whatnot. But you know, at the end of the day, we can just do our best. Even if you were able to do these measures perfectly, you know, COVID is just part of our environment. It's out there, and at some point, there is going to be a COVID case in a school somewhere in Niagara. Hopefully not too many, but at some point it's going to happen. And part of the reason for that is, like I said, the COVID's out there. So even if you were perfect in the schools, those kids are still going home at the end of the day. You guys are going home at the end of the day. You know, who knows what the children are doing outside of school. You know, you're probably out and about going to different places. And so there's a whole other world of exposures out there other than in the school. And at some point, you know, that virus is going to make its way into the school. And so when that does happen, we need to be prepared. So I can tell you that in Ontario, COVID-19 is a reportable disease to public health. So anytime someone in Niagara has or is lab confirmed as COVID-19, it gets reported to us at public health, either, you know, by the lab or by the ordering physician, or sometimes the client themselves reports it to us. Even though we do get those lab results, on occasion there can be delays in terms of when we get it. So there are occasions when the case themselves might be aware of their lab result before we know about it. So you know, in the schools, if you happen to know of a staff case or you happen to know of a child case, we would encourage you to kind of go through your proper channels, and as a school, you know, report that to public health. The other thing that's reportable too is suspected or, you know, probable cases. So I don't want you to think that you have to report to us every time you have somebody that fails a screen or becomes ill. But, you know, if you have a child that has symptoms compatible with COVID, and perhaps you happen to know that they have a family member at home that has COVID as well, that's a, you know, pretty suspicious case, and what I would consider a suspected or probable case, and we would encourage the schools to call that in to us as well. The other thing I'll mention too is I know you're probably all wanting to get just like a detailed step-by-step plan of how everything's going to shake out when there's a case in a school, and we'd love to be able to provide that to you. But you know, after 6 months of doing case and contact management, outbreak management, I can tell you that there's a lot of different variables and factors involved, and we really do treat every case, every contact, every outbreak on a case-by-case basis. And but the purpose of the next few slides is to kind of give you an overview of some of the general things to kind of expect. When it comes to contact management, I can also tell you that our contact management starts right with the first phone call with the case. So before we go too much into actual case management, I just wanted to talk a little bit about you know, what happens if a staff or a student are, you know, in the school and they become unwell or they start showing symptoms. So as a staff member, so first of all, like, you know, Lori's already talked about screening. You screen yourself at the beginning of the day, but as we know, symptoms don't always start at 8 a.m. before you leave the house. So if you find yourself in a situation where you're already at school and you develop symptoms or you start feeling unwell, it is important for you to leave the school immediately. Obviously, you would notify your superiors first, but we want to minimize any potential exposure to other staff and other students. When it comes to ill children, we by no means expect you to diagnose kids. we know you're not healthcare providers. All we really ask is for you to be observant, which I'm sure you've been doing the entire time. Having ill kids at school or ill kids or children develop symptoms during the school day is, I'm sure, not uncommon. And then so it comes down to, like, what do you do if you have an ill child at school? So as was mentioned in the video we just watched, one of the key recommendations for every school is to have an isolation room. So this is the room where you're going to bring the child to while they're awaiting pickup by their parents or guardian. So I'm going to go back into infection prevention and control measures and PPE again, because we're at a point now. So when you have an ill child, now we're in a situation where you require personal protective equipment, potentially dependent on the situation. The masks that you're wearing throughout the day, is kind of a routine type use, right? But once you're now faced with an ill child, and perhaps a child that you are within that 2 meters of, because dependent on the child themselves, the age of the child, and then the situation, maybe the size of your isolation room. You could be in a situation where you're within that 2 meters of a symptomatic person. So now all of a sudden you have to start considering other forms of personal protective equipment. And I can't say with confidence which types of PPE you're going to have, but we are hopeful that you're going to have masks, you're going to have gowns, gloves, and eye protection. So when we think about just again, those portals of entry, so how the germ could get into your body, and we think about, I lost my train of thought, but if we think about the ways the germ gets into your body, that should really be kind of leading you in how you're going to do your risk assessment. So of course, we know that the germ can get in through your eyes, and that's the rationale for wearing eye protection when you're within that 2 meters of the person. You're going to wear your mask, and again, that mask has to cover both your nose and mouth because both are portals of entry. We've all been at Walmarts and whatnot. I'm sure we've all seen the people that have their noses sticking out over the tops of their masks, but I know you guys are not going to do that. You're going to properly wear your masks, and your noses and mouths are going to be covered. The purpose of the gown is to prevent your clothing from being contaminated, because what could happen if you don't have a gown is if you're within close proximity to the child, and perhaps they cough on you, as Brandon talked about, there's that potential for the germ to live on your clothing. And if at some point, later in the day, you're touching your clothing, now you have that germ on your hands, and at some point that germ can make its way to your face and inside your mouth or your nose. So that's the rationale for the gown, and then the gloves also just help protect your hands. But now, given the context of close contact with an ill child, we're now dealing with personal protective equipment. It's really important to change that personal protective equipment. So you're going to take it off before you exit that room, because we're going to consider all that personal protective equipment contaminated, and we don't want you to then contaminate other parts of the school. So we recommend that you have a garbage container at the door. So you're going to doff or take off your gown, your gloves, your mask. Those are going to go into the garbage. There should be some sort of disinfectant there as well, what you're going to use to clean your shield or whatever you're using for eye protection. It is important too, in regards to how you take off your PPE. So Brandon talked about it a little bit. He did have a diagram up, and of course, wearing these types of PPE is going to be new to most of you. So I do recommend that you go to our website and you print off some of those posters and actually have them posted in those isolation rooms. And the reason it is important to take off your personal protective equipment properly is that if you don't do it properly, and again, we're considering all that stuff to be contaminated, it is possible to actually then contaminate yourself as you're removing it. So again, having those posters up and available and accessible to you is definitely recommended. I talked about already that each case, each situation is managed on a case-by-case basis. When we follow up with confirmed cases, and we do follow up with every single confirmed case, and we will hunt them down if we need to, some of the things that we're looking to figure out is, so one of the first things is symptom onset date. So if you think back to when I was talking about incubation period, and when I was speaking to period of infectivity, it all kind of goes back to the symptom onset date. So when we know the symptom onset date, that's going to allow us to figure out what period of time that person was contagious, and that's what we're going to use to guide us in terms of where we're looking for potential contacts or exposures to that person. It's also going to allow us to, somewhat narrow down the time period where that person may have been infected, and so we use it as an opportunity to try to figure out where they could have got it from. It is challenging. Again, 14-day incubation period, meaning that up to that symptom onset date, that person could have been exposed to the virus at any time in the last 14 days. So there's potentially a lot of different places people could have been exposed. Cases will typically self-isolate for 14 days. In addition to isolating at home, we always encourage cases to also isolate away from other family members, if possible. So we understand that some cases are parents and they have young children, and it's impossible to isolate away from children, right? We don't expect cases to neglect their children. But there are things that you can do to kind of minimize the exposure to your children, right? So if you're a case, you have COVID, wearing a mask when you are in close proximity to your child, and of course washing your hands or cleaning your hands as well. So like I touched on earlier with the testing, generally we do not recommend repeat testing for people that are known to have COVID. We don't use negative test results to clear people to return back to work typically. And the reason for that relates back to just some of the limitations with the testing that we previously discussed. So of course, our case follow-ups here at Public Health are certainly a priority, but our follow-ups with contacts are honestly just as much of a priority. Our goal here is to limit, or one of our goals is to limit the spread of disease, infectious diseases. And if we can identify contacts or people that were potentially infected, ensure that they're doing the right things to prevent other people from getting ill, then we've done our job. So what is a contact? So first of all, contacts are usually will be identified by public health, and again, we have kind of a certain criteria that we look for. I'll go into a little bit about that. But a contact is a person who had significant exposure to a confirmed case that could have resulted in the transmission of infection. So again, we follow up with all cases to identify persons that they were exposed to. And some of the things we take into consideration, again, some of these things we've already kind of discussed, but the case's period of infectivity. So if let's say you have a child that tested positive for COVID-19, if they were in the school in the 2 days before their symptom onset, or any time after their symptom onsets, we're going to have to look at potential contacts within the school. But let's say they hadn't been in the school for say 3 days before their symptoms started, and they hadn't been in the school after their symptoms started either. Then we're looking at a situation where there's probably not going to be any exposure in the school. So we're definitely looking at that period of infectivity for the case. And when we do identify potential people that were around that person, we're then looking at the type of exposure. So was it direct contact? So maybe there's a situation where a child had ran up and hugged a teacher or something, or was really upset and had some sort of direct contact with a teacher. That's one potential type of contact. But then we'd also go into a little bit more detail on that, and we'd ask things like, well, how long was that contact for? And then the other thing is, what sort of personal protective equipment was we'll use the example of a teacher. What type of personal protective equipment were they using? And so one of the reasons that that it's recommended or mandated, I suppose, that teachers wear medical masks is that a medical mask not only will help kind of prevent you as a teacher or a staff person from spreading germ to the students, but it's going to protect you from or it's going to help protect you from acquiring infection from your students or other staff people. Unfortunately, we don't have strong evidence that non-medical masks or face coverings would protect the wearer from contracting an illness. And so if we're doing our contact tracing, we find out, oh, the staff person was actually just wearing a face covering. We're going to essentially consider that an exposure. Whereas if they were wearing a medical mask, they were wearing eyewear, they were wearing gloves and gown, that's going to weigh heavily on the decision of whether or not you're a contact. Okay. The other thing I wanted to mention too is that when we are doing our contact management, we don't do this in a bubble, and we're oftentimes really having to rely on external partners, whether it's workplaces or whatnot, and helping give us the information we need to adequately track down contacts. So we are going to be working closely with schools anytime we know of a case that is or contacts that are associated with a school. And some of the information that we're going to require, and we're going to require pretty timely access to it, is things like detailed class lists and cohort lists. So let's say there's a student that is in their class cohort, but maybe they attend an after-school type program as well. So that student potentially has two cohorts. So we would need a list for both those. And that's going to include any potential teachers as well. And then things like bus lists and seating charts and whatnot. And so one of the reasons we want timely access to those lists is that it's going to allow us to more timely be able to follow up with those contacts in a more timely manner. So our goal is to follow up with contacts within 24 to 48 hours upon learning of a new positive case, if not sooner. Generally speaking, contacts of cases will self-isolate for 14 days from their last exposure and also monitor for symptoms. One of the common questions we get is whether household members of contacts need to self-isolate. So I'll give you the example of an educator or teacher who has a child in their class who turns out to be a positive case of COVID, and through the investigation, we determined that the teacher was a high-risk exposure and now needs to self-isolate. The household members of that teacher do not need to isolate as well. So it's typically speaking, contacts of contacts don't need to isolate. But where that recommendation might change is if that contact goes on to develop symptoms and goes for testing. At that point, we would ask that household members isolate until that person gets the results of their tests back. And as I mentioned before, if you are identified as a high-risk contact and testing ends up being recommended for you in that situation, a negative test result does not allow you to come out of isolation before your 14 days. So when you're identified as a high-risk contact, you're pretty much in isolation for the whole 14 days. The other thing that could happen too is that if you are identified as a contact, you have to isolate. On day 5, you develop symptoms. Day 6, you get tested. Day 7, you find out, you're a positive case as well. You're infected. Your isolation period is going to change. So now it's going to be 14 days from your symptom onset date. So the last slide I'm going to talk about is just personal health information. So, lab results, positive or negative lab results for COVID are considered a piece of personal health information. Diagnoses of COVID-19 is personal health information. And we can't release that type of information without a person's explicit consent. And I know, when there's, a confirmed case in a workplace or maybe just in your, anytime you think that you were potentially exposed to a person, the first thing you want to know is, well, who was it? Like, and I can understand that, especially once your anxiety starts ramping up, and so yeah, I can understand that. But at the end of the day, public health cannot release that information without consent of the person. So this applies to both staff. So if you're a staff person and you test positive, we can't release your health information to the employer, and we can't release a child's health information as well. Now, all that being said, when we do our case and contact management, we do always, I shouldn't say always, but where it's necessary, we'll ask a case or their guardian for consent to share their results or to identify them as a case of COVID, because it certainly does make our job easier to do the contact tracing, the contact management, figuring out what other people were exposed to that case when we're able to tell people who the case was. So we do try to do that, but at the end of the day, a person does not have to give us consent to release that sort of information.
Great, thanks, Brian. Great overview on case and contact management. So that's step one at public health. And in regards to the outbreak management, I just want to point out that there are documents on the ministry website for educators in regards to outbreak management response. So I would encourage you to take a read. It's not a difficult read, but it's an interesting read, just so that you have an idea of what potentially can happen, or like Brian noted, it's potentially when it's going to happen here in Niagara. And just remember, that we're all kind of learning together, and this is going to be a case-by-case basis, and we'll keep our fingers crossed that Niagara doesn't have the first school outbreak this year, and that maybe we have some learnings from other public health units and schools and school boards. So just to note that local public health units across Ontario, the 36 public health departments, are responsible for determining if an outbreak exists. And, we do have background in school outbreaks, not in COVID, of course, right now, but we've dealt with outbreaks in schools, whether it be elementary and secondary, with infectious diseases such as measles and mumps and other reportable diseases. The ministry has defined what an outbreak is going to be in a school. So the definition on this slide is one that we will be using. They've defined outbreaks in long-term care, retirement homes. So every sector has a bit of a different flavor in regards to the case definition. So we're looking at using this definition. So 2 or more lab confirmed cases in students and or staff in a school with an epidemiologically linked situation within a 14-day period, so that incubation period that Brian covered, where at least one of those cases could have reasonably acquired their infection in the school. And again, looking at the cohort, so the school cohort, maybe it's the transportation cohort, it's the before or after school cohort. So public health will be working with the school, external partners that maybe are in the school, to try to determine if there is that link and what that link actually is. So we'll talk a little bit more about, obviously Brian touched on the importance of lists. So we need those to determine if this indeed is an outbreak, or is it a single case and it's going to be managed a little bit differently than an outbreak situation. The one thing that to note around outbreaks is that we've learned, so we've had a lot of learnings with our long-term care facilities and our retirement homes and acute care, is that every case again will be unique. It's a case that we will review closely with we'll work closely with our medical officer of health or our associate medical officer of health in regards to recommendations, and obviously working closely with the school boards. And outbreaks are always best managed in a coordinated process. And that communication between school boards and public health are key when we're dealing with outbreaks. So the role of public health in regards to outbreak management, Obviously, as I noted already, to collaborate with schools and external partners. We're responsible for case and contact management. I won't touch on that because Brian did an awesome job. I'm going to skip the next bullet in regards to outbreak control measures. I'll leave that to the end. Provide recommendations on isolation of cohorts. So Brian did note that, and I just wanted to, you know, bring it forward that, you know, outbreaks don't mean that the whole school is going to be dismissed. Okay, it's really based on the information that we have within you know, the context of the cohorts and the type of exposure. So just to note that you know, if we go into an outbreak situation, doesn't mean that the entire school community is going to be off. It's going to be very particular. Now, saying that, I can say, you know, potentially if there's secondary transmission or we see ongoing transmission or widespread transmission in that school, then recommendations might be different in regards to the dismissal of the school and further recommendations. We'll provide recommendations on testing, and we will also facilitate a coordinated approach for assessment centers. So Brian noted the time. Typically, you know, if you're deemed a significant contact, we will be recommending that you'll be tested between days 5 and 7. The thing that I wanted to note too is that testing is not mandatory. Okay, so it's a recommendation that public health will make. We can't force anybody to be tested, but obviously they're still going to be off for the 14 days. You're still going to be off. The child is still going to be off for the 14 days, but we cannot force you to be tested. If you choose to be tested, we're going to work with you as a contact or you as the case and facilitate any additional testing that may happen. And we work with the assessment center, so we actually issue what's called an outbreak number. And this happens in long-term care facilities to facilitate testing. So it just kind of boosts you up in the queue. Once your swab is collected, your NP swab, it's sent off to a lab, which is typically could be outside of the Niagara region for testing. And it just kind of advances you in the queue for those results. So yeah, we'll be speaking to you about that. Our environmental health division, so Brandon's division would conduct those on-site investigations at school with IPAC checklists that they'll be going over with senior staff, custodial staff. Our communication folks work already closely and have been working closely with your communication folks in the board or your schools, and that doesn't stop. And actually, it is something that needs to happen very early in all of this, so that we're aligning our messages. And obviously, we just like long-term care facilities that have been in outbreaks, we really understand the importance of the community knowing first through the principal or vice principal or school board of what is actually happening in that building before public health releases it out to the community or has to start addressing questions. The one learning that we've had is that unfortunately, you know, the rumor mill starts, you know, things sometimes leak out, you know, and it's usually through social media. Where somebody may post, just to give you an example, their results, and like I'm not sure why they want to post their results, but it happens, right? And that usually starts the flurry of calls to public health. It'll start the flurry of calls to your facility. So we just need to be all on the same page and working with our communications and our messaging. Templates have already started. I can let you know that they're being developed at public health to be shared with the school boards in regards to you know, cases, and that's something that we can share with you. The last point there is where we coordinate sometimes with other public health units, especially if the case or contact lives outside of Niagara. And this is not unusual. We do this for all other diseases of public health significance. Just to note that obviously you know that in Niagara, our jurisdiction is Grimsby to Fort Erie. If a teacher is the case or the teacher is a contact, you know, most likely Niagara is going to be taking the lead on providing those recommendations. Now, saying that, we do have to let the respective health unit know if that teacher lives in the Hamilton area. We have to let Hamilton, the City of Hamilton Public Health know about this. But you know, we will most likely, based on operational guidance documents that are out right now, that we'll be taking the lead in providing those recommendations. If that public health unit, I'm just going to say, decides that they want to take on the case and contact management, we all have the same operational guidelines across Ontario public health units, but it's the way that sometimes the medical officer of health may, change the flavor, so to speak, of the recommendation. So we all just need to, understand that there could be slight variances in the recommendations, and I'm saying slight, very slight, but there's always that potential. The outbreak control measures, I skipped over that bullet, but if there is an outbreak in the school, again, case by case, we're learning, but some of the measures that have been outlined in the operational guidance document, besides dismissal of cohorts, potential dismissal of, the entire school if there's widespread transmission, is, we really need to be considering who's entering our school. So those essential visitors, who are they, and do they need to come into the school? Outbreak signage would be posted alerting, obviously families that are already going to know that maybe a cohort is in dismissal, where that potentially is. We probably will be looking at reducing staff movement between cohorts, right? So we're reducing that potential for transmission, and also restricting staff potentially from working in other schools. So again, that's a discussion point, and that goes for other support staff that might be coming into the schools that go into other schools in the area, such as maybe healthcare providers, nursing staff that come in to do medical procedures or services with students. At this time, we also need to think about reinforcing our social bubbles, in school and outside of school. Just those friendly messages to everybody about masks, eye protection, hand hygiene, and physical distancing. Again, I'm going to note screen, and that's our responsibility. The environmental cleaning will definitely be enhanced, and obviously letting new enrollers into the school know that there is currently an outbreak happening. And just going back for 1 second, it's not on the slide, but I need to say, if we've declared an outbreak, we need to declare that outbreak over at some point in time. Typically the definition of when we declare an outbreak over is typically when 14 days have passed and there's no evidence of ongoing transmission of COVID-19 in the school, and also that test results. So if we know that staff and students are being tested, we want to ensure that those test results are all back, and that obviously they're all negative before we declare the outbreak over. The one thing, school areas can be reopened during an outbreak. So if there's no transmission going on in additional cohorts, we may stagger them back in, but again, that's in consultation with schools and our medical officer of health. And obviously, there's the very important role of school boards and administrators in all of this. Obviously, Brian mentioned under the Health Protection and Promotion Act, it's your responsibility as a school administrator or as a teacher to report probable or confirmed cases to public health. Our numbers will be available throughout at the end of this presentation, and I'm sure you're aware. The diseases of public health significance poster that you've received in the past has been updated, and that will be coming out in your principal package, I believe, in the next couple of weeks. So COVID-19 will be found under novel coronavirus on that diseases of public health significance poster. Implementing the outbreak control measures in consultation with Niagara Region Public Health, and communicating, and I've already mentioned this, with staff, families, and your external partners. And that communication is probably going to look different for different schools, depending on whether it's going to be letters, e-blasts, calls, posting on your website, that's in the operational guidance document, as well as public health posting potentially on our external site. maintaining those accurate records of staff, students, and visitors. And Brian mentioned, first, last name. We'll be looking for addresses and telephone numbers. We know that families may not have, phones available to them, but hopefully they have maybe a phone number for an extended family member that we would be calling to reach that parent to discuss isolation. So all that information is really important and critical, and we look for it usually within that 24-hour period to ensure that we're contacting potentially all those significant contacts. Provide training related to infection prevention and control. So this is the start of that, but certainly it's potentially not the end as things change, and we have resources. You have school nurses that you'll have access to in obtaining that information, and also just ensuring that your staff have the appropriate PPE and that it's accessible. So again, that designated or that isolation room is having those key pieces of PPE available for staff to access.
Thank you so much, Lori. So this last section I'm going to speak to is really about how do you as educators and school staff go about continuing your support for students, and how do you access support? Because we know that even though there is a pandemic, it doesn't mean that all other problems stop. And there are going to be some challenges that come up and some problems that arise where it's difficult to maintain that infection prevention and control practices. So really, we know that this pandemic has caused a lot of negative impacts for students. So how do you use the information available to you, and how do you access that support to properly go about really reducing that risk of transmission? So as I mentioned, we know the research and the literature does show that there are negative impacts on school closures, not only for adults, but of course for children as well, especially children. We know that school is often that safe place for children, and that place where they get that physical activity and often their only nutritious meal of the day through nutrition programs or such. So we can see that these negative impacts are showing in different ways. We can see that being away from school for 6 months, being at home for that long, has shown has decreased physical activity, has increased screen time, sedentary behavior, increased sleep time, increased food intake, and increased unhealthy food. So that's going to present in a lot of ways. So it's really important that we are aware of this and we're ready to manage these problems as children do return to school, especially when it comes to that psychosocial aspect, their mental health and well-being. We know that being isolated away from friends with all this new rules and protocols to follow in a pandemic, it's definitely hard for children, and we can see that they're feeling depressed, they're feeling anxious, they have difficulty concentrating, there's boredom, irritability, difficulty following routines, and self-control difficulties. All of these things are going to present within students, especially as they come back and prepare for this kind of the new protocols that are going to be put in place in this new system to navigate. And then of course this last section here, which is very unfortunate, but we know that a lot of child abuse reportings happen within school because it's educators and school staff such as yourself that reports it. And we know that there are reports, it is reporting that there are less during COVID. So we know that there is an increase in risk in physical and emotional maltreatment, in gender-based violence, in separation from caregivers, and especially that social exclusion. When we consider if a child is an only child and they're away from their friends, they're away from this support network that they have built at school, it's really important that we are aware that as we return to school, these impacts might show themselves in a lot of different ways. But it's really important in acknowledging these impacts that we're really using age-appropriate education to address them within schools. It really has to start with reassuring children about this virus and providing them with the tools and supports necessary for them to make healthier changes. So really encouraging that physical distancing, and when it's not possible, really encouraging proper respiratory etiquette, proper mask usage, and hand hygiene. I did include a link here below from our Associate Medical Officer of Health, Dr. Feller, 3 different videos about speaking to your children about COVID. And like I said, it really comes down to making sure that that they understand, like, for example, for younger kids, that why do we wear a mask? We wear it not only to protect ourselves, but to protect people around us. And why do we wash our hands? It's really to get rid of those germs. There's a lot of resources on our website that I'll go through afterwards, but really addressing those impacts that the school closures have had on children is really going to come down to that education piece. Next, as we kind of address, is really about personal health information and that rumor mill that Lori spoke to. There may be situations where students and staff are asked to self-isolate, or they may need to stay home for potential exposure or due to possible symptoms or a variety of other reasons. And it's really important that we address those conversations and we pay attention to those conversations, whether it be in the classroom or on social media or in the hallways, and we address them and we remind students and staff that it is someone's own personal health information, and there could be a variety of other reasons why someone may be off for a few weeks or learning from home for a few weeks. Like we said, it's their personal health information for them to keep, and we need consent to share it. The other thing that we have mentioned here is children not wearing masks. There may be reasons, medical reasons, why a child or a staff member may not be able to wear a mask. So it's important to really address those rumors and the conversations and the stigma when you hear it within classrooms. And of course, one of the most important things to really acknowledge is that we can provide all these infection prevention and control recommendations, and we can provide all these protocols and recommendations to prevent that spread of infection. But as educators, you know that there are going to be challenges that may come up where you're not able to physically distance from the student. Like for example, if there's emotional support or you're consoling a student, we don't want you to feel scared to be close to a student. But if there is a chance that you are within that 2-meter distance, it's really important that when you can't maintain that first line of defense, that physical distancing, that you're really considering all the other line of defenses. You need to consider that length of exposure. So right now, for example, we consider 15 minutes, anything above that, a high risk exposure. Now that is subject to change, as a lot of our recommendations do change. But really think about how long you're going to be within 2 meters of that student. And if it is going to be longer, really focus on your good hand hygiene, your respiratory etiquette, proper mask usage, and the possible use of PPE. That kind of leads into the next situation, especially with behavioral needs and special education needs. So we know that that with certain students and with certain situations that there may not be the ability to physically distance from them, or there may need to be additional safety protocols and accommodations put in place. And I think the operational guidance document really lays it out well, is that it really has to come from planning. So meeting with the parent or guardian and the special education staff and the administration and possibly public health to really anticipate possible changes to that IEP and really consider if the child is not able to wear a mask, if you're not able to physically distance, if there is going to be a risk of coming in contact with bodily fluids or any droplets, that the additional supports are put in place. For example, PPE, additional environmental cleaning, and possible accommodations for transportation services. And one of the most important things is supporting you, because we know that we are not asking you to be healthcare providers, as we mentioned before. We are not asking you to diagnose and to be experts in this content. Really, this is going to be a partnership moving forward when it comes to reducing the risk of transmission within schools. It's truly a partnership, and know that you have access to resources. Something we've been telling ourselves since March in public health is that this is a marathon and not a sprint. It really is important that you are pacing yourself when it comes to really reducing that risk of transmission. It's really important that you're taking care of yourself and being aware of the thoughts and anxieties that you're having and making sure that you're not presenting them to your students. Really being a good support system and providing that reassurance even when you are feeling anxious yourself. Be mindful of the thoughts that you're having and know that you can reach out. Like I said, this is a partnership, which leads me into my next slide. typically with our school health nurses, we are often used to having one school health nurse assigned per school. Now this year, of course, we are adjusting things a little bit to make sure that access to support is easier than ever. So we have created a COVID info line specifically for school health staff or school staff in general and educators such as yourselves. There is also the option to enter a live chat with our nurses, which is available in 90 different languages. And you still have the option to email school health staff for any requests or any questions or concerns that may come up. We also have school health nurses that are going to be working with the infectious disease nurses and public health inspectors to liaise directly with schools regarding cases, contacts, outbreak management and follow-up, and infection prevention and control. We also have nurses that are going to be informing and supporting health promotion needs for our web resources, social media, and other communication tools. We still have all the supports that we did provide in the previous years. They are still there for your use. All of our resources will be updated on the website, and you're still able to reach out to us if you have any questions or concerns or need additional support or resources. And lastly, we still have our school health nurses supporting secondary students with access to public health nurses for non-COVID related inquiries. So that includes health teaching, referrals and support for other services, including sexual health support. So to access our new school health line, you can call us at 905-688-8248. You can then press 7. And then if you have a parent or guardian that has questions, you can direct them to this line as well. And if they press 2, they'll be directed to our general COVID info line, and they're able to speak to a public health staff or school health nurse. And if you press 4 as an educator, principal, or school board representative, or any other school staff member, if you have any questions or concerns, you'll be directed to our school health nurses. And as I mentioned, there is the chat or email options. We also have our new Reopening Schools website, which is school-specific content for educators and school staff such as yourself, and easy access to all the resources. So I'm actually going to take the opportunity to be going through our website, showing you how to use it and access those resources now. But first, I want to give you the contact information for the testing centers. As Lori and Brian mentioned, that screening is a continuous process. It's not just what happens when you walk out the door in the morning. It's a continuous process through the day. So if you do feel that you are experiencing symptoms and you are going to self-isolate, you can access the testing center by calling Niagara Health System themselves at extension or 905-378-4647 extension 42819. And you can book an appointment through them. You can also call our COVID info line, as mentioned before, by pressing 2 to the parent, the general COVID info line, and they're able to refer you for testing as well. And as mentioned earlier, walk-ins are accepted, however, appointment is preferred. So now I'm going to take you through our website and give you an idea of the resources that are there and the numbers that are there, the stats, the current stats there as well, and how to read into them. So if you go to niagararegion.ca, right at the top of the webpage, there is updates on COVID, and it'll take you right to our COVID information page. On here, there's all the information on how to access our COVID info line, which is available 7 days a week. There's also the availability for the chat online. The first thing I want to show everyone is over here on the right for the overview of COVID in Niagara. Here you can find all the up-to-date information, and it does update very regularly. The numbers that we are presenting to you today are actually different from the ones that were on the website this morning. So as you can see here, we've had a total number of 940 cases within Niagara and a total number of 11 active cases and 1 outbreak. If you scroll down to cases hospitalized, this is for cases overall, for the 940 cases in total. We can see that 10% of cases were hospitalized, 3% needed intensive care, and 86% isolated at home. In this next section called cases, we can see the total number of cases, once again, the 940 cases in total, with 64 deaths within Niagara. In this chart below here on the left, we can see cases per municipality, and you can actually see active cases, so current cases by municipality. On the right here, we have cases by outbreak category. So you can see non-outbreak cases versus long-term care, retirement home outbreak, community outbreak, hospital, and congregate setting. And here you can see the exposure. You can see that majority of exposures for COVID-19 are close contact, with some being community, travel, and contact with someone who has traveled. Below on the right, I just want to highlight this section right here as well, because we can see the number of cases per age group. And if you hover over the less than 20 age group, you can see that 62 of our 940 cases were of those under the age of 20. This next section I'm going to hand over to Lori.
Yeah, so just to highlight what we've been experiencing here in Niagara in regards to long-term care retirement, acute care site outbreaks in community. So it's really nice to see that we only have one active outbreak on the board right now. So very different from April, May, when we had a lot. You could see how many that we've closed. And again, mainly I would say that was our long-term care retirement home sector that experienced, and you can see the number of cases that, unfortunately occurred in those long-term care facility retirement home settings, that 303. There's the gender breakdown below. And, just to note that the outbreak cases by age group, a few months ago, I would have said that it's the 80+ group, but now we're looking at, that 20 to 39-year-old age group creeping up, and probably more so from when, we moved into the different stages, and workplaces were opening and people, socializing a bit more. So so it's a good thing we're only at one outbreak. So I can just let's try to keep it at that.
And our last section here is our reopening section, which you can find how many cases per day, how many new cases I should say. So there's the case growth from the first case. You can see from March all the way here until September. You can see that there is no new cases on September 3rd and 2 new cases on September 2nd. When we scroll down here, you can see the average number of cases hospitalized per day in the past 7 days. And here is our public health system capacity. So our goal, as mentioned, is to get in contact with positive cases within 24 hours. And we can see that we've met our goal at 100%. And over here, we can see our goal of reaching contacts of a positive case reached within 1 day. The times that we don't see this number in the green is sometimes when we don't have their phone number or they're not answering. But as Lori has mentioned before, we are resourceful at public health. If we don't hear from someone within a reasonable time frame, sometimes we do make house calls. And down below here, if you look at this number and you see this red, and maybe it may look concerning as it is health system capacity, but this number here is how many beds within Niagara are occupied in total for any number of reasons. So the whole reason is this is about that conversation that we had in March about flattening the curve as to not overload healthcare systems. And then we'll go back to the main page because there's a few more pages that I just want to review. Actually, the one that we should really review is testing and lab results. So under this testing and lab results section, you can find all the information about how to access testing. So how to book an appointment. We have information about screening and then accessing lab results. So one of the best ways to access your lab results is through MyChart. There is also the provincial portal, but with MyChart, what we do is we suggest that you sign up for MyChart when you book the test, when you get your appointment for testing, because it does take a day or two to activate your account. And what you'll need to do is upload a clear photo of your health card and a photo of you with your health card. If that doesn't work, you can also call your healthcare provider, and they are able to offer you your results. Unfortunately, we at Public Health we don't offer results. Unless you are positive, then we will be in contact within 24 hours. The next page I want to go to is how to protect yourself. So in this section, as Brandon mentioned, you'll find all the information about cleaning and disinfecting and about all environmental cleaning and disinfecting recommendations. So there's access to a bunch of different resources here. when you need it. And then the last section that I will highlight as well is our new reopening schools during COVID webpage. So on this page, you can find all of the provincial guidelines to safely reopen. On the right, you can find posters for the classroom, any guidance that you may need, Sick Kids guidance for reopening, and then our teaching tools as well for kindergarten to grade 1, because we know that's a very important topic for that age group. And here, as we discussed, is the contact information to access our school health nurses or public health staff. And below, finally, I'll just highlight all the information here about prevention and protection, information about screening, face coverings, cleaning, disinfecting, and much more. So we'll go back to our presentation here, and I'll open up the mics for chat. So if you want to ask a question, if you don't want to over microphone, please feel free to enter your questions into the chat, and we'll remain around we'll allow a few minutes for questions. Okay, so if you'd like, you can unmute yourself now and ask any question you'd like. I should also mention, as I mentioned earlier, there is additional Q&A that will be sent out following this presentation, along with the slide deck.
Hi, Carrie. Yeah, paper bags can be used. However, we say that those ones are single use, just based on the risk of contamination and putting the mask in and out of the bag.
We will mention too that N95 masks are certainly above and beyond what is required of you. So I mean, if you want to use like an above a higher level of protection, that's great, but it's not actually required. So just a regular medical, surgical, or medical procedure type mask is sufficient as well. And the same kind of storage and reuse criteria would apply to that type of mask as well. Yeah, so I believe, a surgical type or / procedure mask would fall into level 1. Just to give you a little background information too, in the event you were interested, N95 masks are actually considered respirators, and their typical intention, at least in kind of like a healthcare setting, or not even healthcare setting, but for healthcare purposes, is that they're more intended for like airborne diseases, so things like tuberculosis and measles, and so they filter out the germs that are more a finer particulate in the air. But with COVID, like we talked about before, it's spread through large droplets. And so that's why the level 1 like procedure / surgical type masks are sufficient. You don't need the higher level that's going to filter out those fine particulates.
And I think you'll probably find that procedural mask or the medical mask is a lot more comfortable to be using for your school day than an N95, which could be pretty restrictive and also, you know, a little more difficult to tolerate for an extended period of time, especially if you're there's the potential for the face shield to be used as well over top of an N95.
And just in case you happen to have friends or family members that are healthcare providers, they might be wearing N95 masks, and it has more to do with maybe they're involved with doing medical procedures that could cause aerosolizations of the virus.
And also, if N95s, if your family members are wearing them and suggesting to wear them, and they're providing them for you, that N95s are fit tested, so it's based on your face shape, and there is some testing that has to happen before you actually use them for them to effectively work.
Yeah, so we it was actually just a few hours ago that it was brought to our attention that at this time PPE for independent schools had not been received by the province, and yeah, we haven't heard anything additional at this point. So I mean, we're what I told the last group is that us here in this room were small spokes in this wheel, and that certainly this kind of concern we can bring forward to the upper levels of management and whatnot that are going to discuss some of these issues. But I don't know what's going to happen with the supply and whether the province is going to supply you any. But we definitely recommend that you do your best in trying to obtain supply, even if it's not from the province. So we will maybe just leave the webinar open just for a few more minutes in case people are typing out some lengthy questions for us, or if there's any last minute type questions that you wanted to do over the mic.
Yes, public health inspectors will be going into schools, but it will only be based on if there's a case and there's or a potential outbreak to follow up. At this point, we won't be doing any proactive visits. We have identified a few high-risk schools in the area or in the region, and we will be limiting our visits, our kind of proactive or pre-visits to a list of about 10. Oh yeah, there will definitely be contact with the schools. It wouldn't be any surprise visits or anything of that nature. It'll be a more collaborative approach.
Also keep in mind that These plans are constantly evolving, and honestly, we're continually looking for opportunities to provide support and service. And a lot of times it comes down to like what our capacity is in terms of time and just manpower and whatnot. So even though we're starting with these 10 high risk kind of priority type schools, there is always the possibility that could change in the future.
And as it was mentioned in the presentation, for additional training and support, if you feel that you do have other questions or concerns, or you do need additional support, please don't hesitate to reach out to that school health line, that COVID line for school health nurses. Please feel free to reach out with any questions or concerns that you do have.
So in regards to the question about temperature screening, it's not required, and there are limitations to it. So as we kind of discussed earlier on in the presentation on symptoms, there's a lot of different symptoms, right? So the temperature check is really just screening for that one symptom, and it doesn't, just because someone doesn't have a fever, it doesn't by any means rule out infection. I guess the one advantage to doing temperature checks is that if for some reason somebody's choosing to be untruthful about their symptoms and they happen to have a fever, it's it's an objective way to assess someone for symptoms. So that would be one advantage, but the temperature check is not actually required. One other thing I'll just mention about temperature checks is just if you are a school that's doing temperature checks, to be mindful of like the type of thermometer that you're using, and to make sure that it's meant to be used for multiple people. And if there's anything like probe covers, that you're using the probe covers appropriately. The thermometer should be wiped down in between uses as well. And in general, just recommending the cleaning and disinfection requirements and the manufacturer's instructions for use of that particular thermometer.
Okay, so thank you everyone for joining us this afternoon. Like I mentioned, these slides will be sent out following the presentations with additional Q&A and a recording to this presentation. If you have any questions moving forward, please don't hesitate to reach out to our COVID info line. Thank you.
Thank you, everyone.
Thanks, everyone.